if cancers and stuff are caught early, then they've got a lot better kind of chance of things being better off.
Even if there is something there, that doesn't necessarily mean it's really bad.
No, it just means that there'll be further investigations.
Yeah.
Welcome to my TED Talk. They call them speculums.
Just checking for any lumps down there, or any unusual lumps or anything in place or anything, or if you just squeeze them. I just feel around and just check.
And what about boob size? I'm bigger than some
Well,
women.
I'm quite big as well. So.
I imagine if you're squishing your boob down, you're not going to choose it for your Saturday night entertainment, are you?
So I'm Ash, and I suffer with anxieties and severe depression, and I have a diagnosis of complex PTSD. We're talking today, aren't we, about serious mental illness and cancer screening. And I just want to get the message out to people that when we hear the word cancer, we automatically go into fear mode, but because we've got additional needs through our mental illness, we tend to have, I tend to have a lot more anxiety, a lot more fear about things associated with that. Right, so what this is bowel screening test.
Right,
and what happens is you get a letter and you get this kit that comes. Right, and what you have to do is, well, I'll show you, shall I? Yeah, I'll show you. we'll use this go here, but I'll show you. Yeah.
What, you'd say it's not real poo?
Well, I don't know. I'm not an aficionado on real poo, Karen, so I don't know. But we'll assume.
Does it smell like
we'll assume that this isn't real poo. So what you get is you get your kit there, and you get like your instructions.
right.
And that's the capsule that it kind of comes in.
Right.
Because none of this, you don't have to touch the poo yourself.
Especially if it looks like that.
What you do is you get this, right? And then what you do is you take it out.
Right. Okay.
That's got water in it, and that's kind of like the solution.
Right.
So you don't tip that out. So what you would do is you would reach down into your bowl and then into your container, and all you would do is just go like that.
Okay.
Okay, and then all you would do then is then put that in there and turn it until it clicks.
Right.
Yeah? And then what you do is you just put it in there.
Yeah.
Put it in, and it's trapped 48 hours.
Oh, right, cool.
So it's as easy as that. And the thing is, like, people are dying. Do you know, like, people are dying 20 years early.
Yeah.
And that's all you've got to do.
Hi, my name's Sarah Rose. I have bipolar, been diagnosed for about 20 years now. My mum has recently survived breast cancer. She's had a breast removed. She's now got the all clear. And a friend also had breast cancer and had a lump removed, and she's got the all clear now. So it's been something that's been throughout my life, so I'm really aware of keeping on checking myself, and it's something that I've instilled in my girls as well. I've got 2 daughters, that they should, be checking themselves regularly. Yeah, so I went for my breast screening last year, and I think it must be the 2nd one I've been to now, and it was in Asda car park.
Did you get your load of shopping while you were there?
Did you get your roll back?
So they have a van outside,
Right.
and it's just like this porta cabin thing that you go in, so you go up the steps, and then you've got like a tiny little cubicle that you can just get changed. So you take your top off, and then the radiographer takes all your details and stuff like that. Then you go through, and there's like these footprints where you have to stand just in front of where they do the mammogram, and then you've got to kind of plonk your boobs on, and then they press your boob between the 2 plates, so they can take the X-ray.
Right.
So it's.
Is it cold, Sarah?
I can't remember whether it was cold or not. I mean, it wasn't very comfortable, I have to say. It didn't hurt, but, you know, it's... The thing is you're getting screened, so they notice things early. Yeah. So it's worth putting up with that, bit of comfort. Yeah, exactly. You can speak to your GP and ask if you can go and have a look around. So, go to without actually having the mammogram, they can go and show you the machine and the cubicles and everything and talk you through it without actually having it done, just to put your mind at rest.
Hi, I'm Karen. I've got some history of experiencing severe depression and anxiety. My dad died when he was quite young, so when I got to a similar age to my dad, I became a little bit more anxious about my own health and thought, I don't want to die young as well. So for me, anything I could do to prevent something that I might become ill with by having screening, it was one of those things I thought, I'm not going to turn that down. So when I first went for cervical smear, it was before I had children, so of course it was excruciatingly embarrassing. It's one of those things, and I was thinking, what am I going to wear for this screening? What will happen? And I had no idea what to expect, because back then I didn't know you could ask to meet the nurse, look at the equipment they will use. So I went in quite terrified for my first cervical smear. But it wasn't as bad as I thought it was going to be. Welcome to my TED Talk.
What are they?
They call them speculums, and it's what they use when you go for your cervical smear test, Sarah. I'm sure you've seen it, don't be kidding me on. When I go for mine, I've just found out today that they have more than one size. When I go for mine, sure, let's get the giant one. But apparently you can ask for a smaller one if it's uncomfortable.
Yeah.
I know when I had my last cervical smear, I don't like to admit it, but it was quite a pleasant experience. I don't know what that says about me, but I think it's because the nurse just put me at ease. She come in and we were talking about, because I was looking for a job at the time, so I whipped my trousers off, and in hindsight it might have been better to wear a skirt because I felt a bit exposed. They do give you a little bit of tissue, like that's going to cover my giant body. So this bit of tissue, and I'm laid there in my socks, feeling a bit awkward, and we're talking about what I might do for a job. Right. Like, just relax yourself, Karen, while I wind it up. Here we go.
I think that they have that little chat to try and make you feel a bit more at ease. So, because you can get really tense, can't you?
If when you find the star, if it's more uncomfortable than you're expecting, tell the nurse to stop. They don't want you to be in pain. Obviously, it's not the most comfortable experience. If you are uncomfortable, feel free. The point is, if you are uncomfortable, feel free to say, please stop. They will never push you beyond your limits. They will always respect that you've got choice and autonomy over yourself.
Hi, I'm Gary. I was diagnosed back in 1995 with schizophrenia, and I've lived with schizophrenia for 20 odd years now. And I've just found out about by doing this cancer screening awareness filming, I've just found out about the fit test and what to do with it. And it's been absolutely fantastic to learn about it. And when it comes through on my birthday, my next birthday, because it does come through on your birthdays, usually every 2 years you get a fit test through for the post. So when it does come through on my birthday, I'm going to actually go and do the test and actually get it sent in, because it's so important to get that early intervention in as soon as you can.
It's good that we're having a laugh and we can talk about it, because stuff like this is important, isn't it?
Well, you showing me how to do it today has made me definitely go and do one. I'll definitely go and do one now.
Nice one.
Because you showed me how to do it, and I've got the confidence now to go out and do it myself. You know what I mean? So that's it. I'll definitely do it. Yeah. I'll ring Dr. Spillers. So.
Nice one, Gary.
You've got peace of mind as well. If it comes back, there's nothing. Then you've done it. It's out of the way, isn't it?
Absolutely.
Yeah.
But it's about knowing it's about knowing what's right for you. And if there is any changes or something, if there's anything that's unusual when you check your testicles, or even men, check the pecs, check your pecs as well. Even if there's anything unusual or out of place, then do take it further, report it, get in touch with your GP, or go for one of these screenings. Actually get in touch with these people, because it is so important. That early intervention is so important, and it can save lives basically.